Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care will be obtained. So far, in our discussion of vaccines and childhood diseases, we have discussed measles, mumps, and rubella, and the MMR vaccine. There are more childhood vaccinations that you must be familiar with. And remember, adults are also susceptible to these diseases. Here is the CDC's immunization schedule, childhood immunization schedule. We will continue addressing all vaccinations noted on the schedule. We will also produce videos that discuss human papillomavirus, meningitis, and shingles vaccines. Now we will discuss pertussis, and follow that with videos on diphtheria and tetanus. Pertussis. Pertussis is also known as whooping cough. It is a respiratory infection. The incidence of whooping cough has diminished worldwide because of vaccination programs and improvements in hygiene and the standard of living. But whooping cough is still seen. It has not been eradicated. Whooping cough is mostly a disease that is seen in infants under the age of 2 years. About half of whooping cough cases fall within this range. It is reported that about 70% of children who have not received immunization will develop whooping cough. That's right, 70%. The diagnosis is made clinically and may be confirmed by cultures. If an acute cough persists for 4 to 8 weeks in a child, it points to whooping cough. Determining who has pertussis can be difficult. Whenever possible, clinicians should obtain a nasopharyngeal swab or an aspirate from all persons with suspected cases. A properly obtained nasopharyngeal swab or aspirate is essential for best results. Here is an example of how a nasal swab is obtained. Here is an example of how an aspirate is obtained. Now, other illnesses must always be considered by the physician. Pneumonia, bronchitis, the flu, and other causes of respiratory illness. Now, the incubation period for whooping cough can be 7 to 14 days. It is usually spread by droplet when an infected individual coughs or sneezes. But it can be acquired when people are simply in close contact. There are 3 stages of whooping cough. The catarrhal stage, which is when there is an inflammation of the mucous membranes and with increased production of mucus. This affects the nose and throat. There is a runny nose, a dry cough, and there can be a conjunctivitis. Conjunctivitis is also called a red eye. This stage can last from 7 to 14 days. The next stage is the paroxysmal stage. Paroxysmal coughing involves frequent and violent coughing that can make it hard for a person to breathe. Coughing is an automatic reflex that helps your body rid itself of extra mucus, bacteria, and other foreign substances. Paroxysms of coughing cause a forced inspiration that results in the inspiratory whooping, from which the whooping cough gets its name. Listen again. This stage can last up to 4 weeks. Now, the final stage, or the convalescent or recovery stage, is associated with the less severe cough. Now, there are complications that can occur with whooping cough. There can be complications to the lungs, such as pneumonia or a collapsed lung. That's right, a collapsed lung. There can even be seizures and bleeds in the brain. There can be slowed or stopped breathing and dehydration or weight loss due to feeding difficulties. The most common complications in adults with pertussis are weight loss, urinary incontinence, syncope, and rib fractures from severe coughing. So the complications can be severe. Now the treatment. Healthcare providers generally treat pertussis with antibiotics, and early treatment is very important. Treatment may make the infection less serious if it is treated early, before coughing fits begin. Treatment can also help prevent spreading the disease to close contacts. But treatment after 3 weeks of illness is unlikely to help. By that time, the bacteria are gone from your body, even though you usually will still have symptoms. This is because the bacteria has already done damage to your body. Now the key is prevention. Why put yourself through this if you can prevent it? 2 vaccines in the United States help prevent whooping cough. These vaccines also provide protection against tetanus and diphtheria. Children younger than 7 years old get the DTaP, while older children, teens, and adults get the TDAP. CDC recommends whooping cough vaccines for people of all ages. The DTaP vaccine is a series of 5 shots, typically given in the arm or thigh to children at ages 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. Well, I hope this helps. Have a good day.